My name is Boon Lim. I'm a consultant cardiologist at Welbeck. Today, I'm going to talk about motivation. Motivation to do the right thing to prolong your health. I'll start with a story. I work in the NHS as well. And one of the strongest motivating factors I can see that changes people is when they come in with a heart attack. Now, that is not the motivation you want to have, which is coming too late in your health journey. And so how do you motivate yourself to do the right thing right now when you haven't manifested any of the symptoms yet, to make sure that you never have a heart attack and that your longevity is at the forefront of your attention? And the way I would say this is to pay attention to your health and to understand and educate yourself about the ways in which you can reduce your risk for a heart attack and stroke in the future. Now, with respect to your heart health, we talk about fundamental hard risk factors that will significantly increase your risk of a heart attack. And these are the first steps that you should pay attention to. These are high blood pressure or your blood pressure, cholesterol, be aware of your cholesterol, stress, nutrition, diet, exercise. And if you're aware and become aware of these risk factors, then you would have taken the first step into reducing your risk of developing a heart attack in the future. Now, when we put all these things in context, even with the best motivation, the diet, the nutrition, even if all that is on track, the exercise is good, there is still blind spots. And these are measurables that will only come to light if you have a blood test or if you have your blood pressure checked. So I would suggest that it is in your interest to have a blood test to check your cholesterol levels at your GP practice or to see a cardiologist, and to have your blood pressure measured, because these are things that you may not be able to necessarily feel, and they could be highly abnormal without you knowing. The other thing that you should really bear in mind is your family history. If your mother, father, grandparents, or your brothers or sisters have had events such as a stroke or a heart attack, it really is important for you to pay attention to all the risk factors that we've talked about and really double down on making those risk factors as minimal as possible. So if you want to get your blood cholesterol measured or your blood pressure taken, please see your GP, or you can arrange an appointment to see a cardiologist at Welbeck.